Hey guys. Oh, my name is Gian. I'm from Occupational Therapy here at DMC.
And I'm Adrian from Physical Therapy.
And I'm Diana from Physical Therapy.
So we're here to help you guys. We know that you guys are joining the Biggest Loser Challenge, and we want to make sure that you're going to go about it and protect yourself and not hurt yourself. And so we're going to show you guys some solutions to make sure that you have some longevity, and by the end of the Biggest Loser Challenge, you'll be okay and not hurt. So one of the things that we find is very common is something called upper cross syndrome, and it basically looks a little bit like this. Shoulders are forward, neck is jutting out, and it's probably because you're probably texting a little bit too much. So we're going to show you some solutions to that so that you don't get hurt.
Okay, so one of the things that we can do to really help remedy the upper cross syndrome is a simple thing that we call a pec stretch. So our friend Diana here is going to demonstrate for us. What you want to do is you want to get your hand against a doorway or really any wall that you can push yourself against, and you're going to step through like you're doing a lunge. You should feel a gentle stretch in your pecs. You'll feel it kind of up here close to your shoulder, and you're going to gently turn away and lean into it. Now the goal of this exercise isn't so much to emphasize too much of a stretch, but a gentle stretch so that you can really open yourself up to really create a good healthy habit with your body.
So another thing with upper cross syndrome is having a lot of weak back muscles. So one thing to do to prime yourself for before an exercise is to do an exercise called a scapular squeeze. So what you do is have your palms facing up, and then you're going to pull your elbows back, and then really squeeze your shoulder blades in the back really tight together, and hold it for about 10 seconds, and you can repeat it about 10 times, and you should be ready to go to kind of hit your bench press or any type of upper body movement.
So another thing that we want to talk about is lower cross syndrome. This is pretty commonly seen for people who work in an office setting where they're sitting at a chair. So one thing you'll notice is you have very tight hips, so your hips are kind of benched in or lean inwards, and then you also have kind of a weak back, poor unactivated glutes, and some aching knees. And so there are a couple of different solutions that we can incorporate into your exercise routine to really help remedy that.
So one of the causes of lower cross syndrome is having a weak core and a weak butt. And this exercise is going to help you strengthen those two things at the same time. It's called the glute bridge. So you're going to lay on your back, you're going to have your feet positioned right below your knees, and what you're going to do is you're going to lift your hip up and high enough to where your spine's in alignment, so a little bit higher, and then back down nice and controlled. You really want to make sure you keep tension in your core on the way up and on the way down. So the other reason people get lower cross syndrome is from having tight quads. And this stretch is going to help loosen that up a little bit. So what you're going to do is you're going to place your hands on the wall. You're going to go into a lunge position, just like that. And you're going to drive that right knee forward until you feel the stretch in your back legs quad. You got to hold it for about 30 seconds, gentle stretch, and do it about 3 times and you should be good to go.
Okay, so now we want to talk about some guiding principles when you're getting into your fitness journey. These are just some things to keep in mind when you start to do any exercises that you aren't too familiar with. So some things that you can really consider is when we start doing any squatting or lunging movements. So some ways that we often see it are when people go into a deep squat and their knees kind of just collapse onto the side. Really kind of an awkward posture and really not safe for your body. So what you want to do instead is when you go into that squatting position, make sure your feet are spread just about shoulder width or really whatever works best for your body type. And you're going to go into a squat position, making sure those knees are tracking over the toes. And you're going to come back up nice and gently. That's really important to consider when you're doing these movements so that you can preserve the integrity of the joints right here at the knees. Another thing that you want to take into account when going to the squat position or any other type of lunge position is ensuring that you brace your core. So you really want to squeeze those tummy muscles when you're going into that squat. Make sure that you're going deep, nice and gently, and you're ensuring that you come back nice and straight. Again, the same type of movement can be applied to these types of exercises and other ones that you might be doing as well. So, and also in addition to that, when you go into any squat, any bending position, you want to make sure that you're using a straight back. So if you can go ahead and turn to your side, Diana, and kind of show. So when you go into any type of squatting position, so go ahead and demonstrate once again. You'll see here Diana has a nice straight back when she goes into that squatting position, and maintaining that as she comes back up right there. Same thing can be applied for any types of movements such as like a deadlift or anything like that where it requires you to bend more than you normally would. For upper body movements, you want to make sure that we retract our shoulders, so that same kind of exercise that Adrian talked about earlier in the video. So when you go to do your bicep curls, when you go to do your bench press, all those different movements, keeping packed shoulders are really going to preserve the integrity of that shoulder joint.
So we really hope that you guys utilize some of those tips in your lifestyle, and we want to make sure that if you're ever in any kind of pain in your journey, we want to make sure that we're always here to answer your guys' questions. You don't need to be in pain. And we know that going into this journey of trying to change your lifestyle is definitely going to come with it some challenges, and we're here to definitely help out any way we can. My name is Adrian,
My name is Gian.
And my name is Diana.
and good luck, guys.